Hey guys, it's Coach Kirsty here today. So what we're going to talk about is thoracic mobility. So this is a big problem in our society, particularly if you sit at a desk or you have a very sedentary job, or you tend to only work in one plane of motion, not rotating left and right. So your thoracic spine is between your neck, so your 7 neck vertebrae, and then your lumbar, which is your lower back vertebrae, which there are 5, and there are 12 of your vertebrae. So these are a very mobile area, or supposedly, which means that your neck and your lumbar are supposed to be quite stable. So when this area gets tight or stiff or locked up, that means often you get pain in your neck and your lower back because they are trying to compensate for the lack of mobility in your thoracic area. So in reality, we should be able to turn and rotate to the right or to the left through the upper back, not using your hips and twisting your lower back as well. You should have that ability. So if this is locked up and tight, often you can get pain in this mid-back area, so right where your right stirrup is if you're a woman, or just your mid-back, and often again, as I said before, neck pain, back pain, and sometimes stiffness through your shoulders too. So what I'll give you today is a couple of little exercises that can help you out with your thoracic rotation, and also just to test if you are really stiff in those areas. So Fred, let's get started. So first one I like to do is a kneeling thoracic rotation. So this is really good for getting that movement without movement at the hips. So what we'll do is we'll start on the hands and knees, which make you see best, like this. So you want to make sure that your hips stay nice and still as you do this exercise. You don't want to turn it and twist around with your whole body. So I like to think of having a little spot in your chest, and that's what you're thinking of rotating around, rather than twisting your whole body. So all you want to do is pop one hand up by your temple, like this. Then you want to come down and then turn, twist and rotate around to see if you can get some rotation through your middle back. So going down, turn, twist and rotate. Cool. So if this is quite difficult, you may feel that it's quite restricted. All of the muscles behind your shoulder blade are actually cramping or trying quite hard to get you around there. So it's very good to go on one side just to test and see if you can increase that range of motion each time. Then of course repeating on the other side. So again, here's the mic. Let's turn around. Turning, twisting, and down. There are also a few variations of this. You can also use straight arms as well. Cool. So that's your kneeling thoracic rotation. That's also a really good test of whether you're uneven between the left and the right, because you can notice a significant difference in how far you can actually turn. Okay, the second one, we're using a chair and a pole. So this one is a seated thoracic rotation. So again, this is doing a similar thing. It's locking your hips into place, except it's a little bit easier to just rotate from the right to the left and to mobilize through that thoracic area. So just pop yourself down on a chair, and then put your little dowel, your little stick behind your neck, so where you'd put your barbell if you were doing a barbell squats, on your soft part of your upper traps. So just bring it up and around. The other way again. So bring it down. All you want to do is slowly twist and rotate around to one side, trying to again look behind you, and then back the other way. Okay, so just rotating from the right to left. Gradually you can smoothly roll through like this and just mobilize through the area, so not going through the full range of motion, and it can really help to loosen up that tight tissue that's there. Let's get a little bit of blood flow going. You can also eventually turn and rotate, adding a few variations. Please begin with just the normal one to see how you feel. Cool. So that's your seated thoracic rotation. And then last one is called a hook open, or sometimes in variation forms they're called arches. This sort of be lying on the floor. So just popping down, you want to stack your hips so your knees are on top of each other and your hips are on top of each other, your palms out in front. All you want to do then is reach forward, then just go across your body. It's nice and simple, just reaching forward, rotating and turning. Again, trying to rotate through the middle of your back, through your thoracic area, not too much through your lumbar. Obviously repeating on the other side. Cool. So hopefully that gives you guys a few ideas that you can try out, and just to see if you can mobilize through your thoracic area a little more, which can hopefully reduce your mid-back pain and help your breathing. Alright, until next time guys, see ya!